Hi dan Assalamualaikum. My name is SYAFIAH binti MUHAMAD. My matric number U423034.
Assalamualaikum and hi, my name is AINA FIKRIYAH binti SHAHIDIR and my number matrix is U4230273.
Hi, Assalamualaikum. My name is SYABIELA binti MAHADZIR. My matric number is U4230277.
Hi, my name is IZZATY ZILAH. My matric number is U4230350.
Today I'll be presenting about identification and use of SOP, guideline of safe handling, principle in chemotherapy preparation. First is definition. Cytotoxic drugs function as therapeutic agent which demonstrate cell toxicity by affecting cell reproduction and serve mainly for cancer treatment. Use of SOP guideline or safe handling principle in chemotherapy preparation. First is SOP ensure a standard procedure for preparing cytotoxic drug, reducing medication, error and human mistake. Second is they protect healthcare workers from dangerous exposure using a proper PPE and current engineering controls. Third is the guidelines promote a aseptic technique to maintain drug sterility and patient safety. Lastly is SOP also has a protocol in case of accidental spills and exposure, a quick and safe response.
So I'm going to explain about SOP or guidelines of safe handling principle in chemotherapy preparation. The first is a control of documentation system. Second, we have a training and personnel, which it is a aerialization of hygiene measure. Then we have a entering and exiting from clean areas, including the correct use of protective clothing, which using a head cover, mask, goggles, gown and gloves. After that, we need cleaning and disinfection after doing a chemotherapy preparation. Then, we have a maintenance of equipment, such as a cytotoxic drug reconstitution, CDR, cabinet, a laminar airflow, LUF cabinet, isolator and facility. Then, we have a procedure for monitoring, including trending calibration and qualification of equipment such as autoclaves, thermometers. We also have an operating of equipment where it is applicable to be receiving, sampling and release starting and packaging materials. After the operation equipment, we have a counter checking and release of rejection of finished products, including an emergency release validation of processes. Then a storage and distribution. After that, a procedure for action need to be taken in the case deviation and complaints. We must recall of finished product. Lastly, we need a self-audit for ourselves.
I'm going to talk about safety step. First, wear a proper PPE before entering the hood. Second, ensure the laminar flow hood proper functioning. Third, follow strict aseptic technique to prevent contamination. Next, disinfect hood surface before and after each use. Next, clearly label container and equipment inside the hood. Use a single-use item to prevent cross-contamination. Keep the work area organized and clutter-free. Last but not least, establish a no-entry zone to maintain sterility. Lastly, regularly clear and maintain the hood according to the guideline. Next, I'm going to talk about workflow safety step. First, clean room or CDR room. A totally separate clean room area for the protection of environment. Entrance and exit of the CDR room must be through a containment airlock or sink airlock negative sink. The CDR room must be include first changing and gowning room, second component and utility rooms. Next, preparation room with CDR cabinet. Lastly, storage, receiving and distribution area. Second is safety equipment. All drug reconstitution inside a CDR safety cabinet or vertical laminar flow cabinet. Working in a laminar flow cabinet, first, work close to the HEPA filter. Second, avoid working in dead space. Next, do not remove hand from LFC more often than is necessary. Last but not least, place as fewer items as possible. Lastly, swipe the outside of all items with 70% RMS.
And then the number 3 is isolated device. It's a separation device. It can decrease in the risk of microbiological contamination. They remove the need to have high-grade clean room. Built-in air filtration system lowers particle count in an enclosed area. Pharmaceutical isolator system comprises of 4 main elements. 1. The controlled workspace. 2. The transfer device. 3. The access device. And number 4. The decontamination system. So here's the number 4, which is a personal protection, PPE. Step: how to wear PPE. First, remove the gel wear, wash hand accordingly to 7-step hand wash technique. Put on head cap, put face mask, wear the gown, and wear glove. Now, who can remove the PPE? First, remove the glove, remove the gown, remove the face mask, remove the head cap, and wash hand accordingly to 7-step hand washing technique. Preparation area. 1 is a purpose of the preparation area. It's to minimize contamination from entering clean zone, to act as a buffer zone between unclassified area, to ensure personalized cleaning and hand hygiene, to provide a space for mineral hygiene. 2. Material preparation and transfer. Material entering the clean area are first stage. Transfer should be carried out through pass-through. External packaging is cleaned or removed to avoid introducing particles. The transfer process must be unidirectional from clean to unclean area. 3. Personnel preparation in the area. Personnel must perform hand washing, gowning. Procedures must follow a step-by-step SOP. Proper attire typically include hair cover, mask and shoe cover. Movement should be controlled. 4. Important preparation in aseptic operation, like as a barrier to contamination before entering controlled environment. Ensure personnel are properly gowned and trained before entering sterilized zone. Support the overall clean room classification. Enhances product quality, assurance and patient safety. The preparation area is the first line of defense in monitoring aseptic condition within controlled environment. Control isolated laminar flow. 1. Laminar flow system. A controlled environment where filtered air move in a single uniform direction at a constant speed. 2. Validation and monitoring is a airflow visualization to confirm laminatory. Also, air velocity measurements to confirm consistent flow rates. B. Routine monitoring. 1. Glove integrity test. 2. Periodic validation to ensure continued compliance. 3. Maintenance and cleaning. Filter must be inspected. Surfaces are disinfected regularly using sterilized wipe. Cleaning record and maintenance logs must keep for traceability. 4. Airflow and pressure control. Airflow rate and direction are carefully controlled. Positive pressure is maintained in aseptic zones. Differential pressure between rooms is monitored. Smoke tests are used during validation to visualize airflow. Both isolator and laminar flow system are essential components of contamination control within sterilized processing area.
The requirements of personal protective equipment PPE. First is non-surgical gowns. Surgical gowns, coveralls, apron surgical, head cover, shoe cover, glove, goggles, and face shield or mask. Step-by-step wearing a personal protective equipment. First, remove all personal items, including watch, rings, earrings, and else. Second, start wearing a appropriate attire. Third, perform a hand rub. Then, wear a boot cover. Perform a hand rub. You must wear a N95 mask and perform seal or fit check. Then you need to wear a head cover. Then you need to wear a isolation gown, blood-resistant long-sleeve gown. Next, you have to wear a first pair of gloves, inner on both hands. Then wear a second pair of gloves as an outer on both hands. Lastly, wear a face shield.
Responsible personnel at each step. First is operator, surgeon. Perform hand hygiene and remove accessory. Second is wear head cap, sterile gown, shoes cover, glove and mask. Third is maintain sterile technique during the operation. And lastly is remove PPE carefully to avoid contamination. Second is for scrub nurse or sterile assistant inside sleep area. First is assist the surgeon with gowning and clothing. Prepare and arrange sterile material in the laminar flow cabinet. And lastly is monitors and maintain sterility in the work area. Coagulation nurse or non-sterile assistant outside the sterile area. Retrieve additional supply as needed. Assist with joining or doffing. Fourth is environmental facility personnel. Is ensure laminar flow cabinet and HEPA HEPA filter function properly through cleaning. Avoid working in deep space near filter. Maintain record of role validation, airflow pressure and disinfections.
Safety measures applied. Gowning and gloving procedure. First, preparation. Beginning by performing a thorough surgical hand scrub from fingertips to elbow. Second, keep your hand above elbow level to prevent water or contamination from running down. Third, after rinsing, dry each out separately using a sterilized towel. Second, putting on the sterilized gown. Pick up the gown carefully by the inside neckline and let it unfold naturally. Second, make sure the outer sterilized surface doesn't touch your body or surrounding. Third, slip your arm partway into the sleeves while keeping your hand inside the fabric. Next, the circulation nurse will help to pull the gown over your shoulders and tie the back strap. Lastly, only the front of the gown and sleeves are considered sterilized. Third, wearing sterilized glove, closet gloving technique. First, with your hand still inside the sleeves, open the sterilized glove packet. Second, pick up the first glove by its inner cuff, align it properly without touching the sterilized area, and pull it over the gown sleeve. Third, make sure the glove cuff completely cover the gown curve. Lastly, repeat the same step for the other hand without exposing bare skin to avoid contamination. Lastly, final check and securing. First, ensure that the strap on the gown are not loose or open to prevent contamination. Second, ensure that glove and gown fit properly without any trace. Next, ensure that your hands are visible above your waist and in front of your body at all times. Lastly, avoid turning your back to the preparation table. Chemotherapy drug, IVINS 100 ml over 50 minutes D1. Indication, fluid and electrolyte replacement in dehydration, hypovolemia or shock. Used to maintain acid-base balance and hydration during chemotherapy. Mechanism of action, sodium chloride is an isotonic crystalloid solution. It works by restoring extracellular fluid volume and electrolyte balance. It mimics plasma osmolality, making it suitable for rehydration and as a carry for IV medication, side effect, rash, and itching. Chemotherapy drug selection and dosing. First, IVINS 250 ml over 30 minutes D1. Dosing, volume prescribed is 250 ml to give over 30 minutes. So 250 ml divided with 30 minutes equal to 8.33 ml per minute.
For labeling, hospital is KPZ Ipoh Specialist Hospital. The medicine is normal saline 0.9% IV infusions, 250 ml. The quantity is 1 bag, to be given as IV infusions over 30 minutes before chemotherapy as a hydrations. This is used for single use only and discard unused portions. Storage is store below 25 Celsius and do not freeze. This medicine is used for intravenous use only. Safe transport, use clean sealed container, keep unwrapped and sprayed from cytotoxic drug. Second is handle gently to avoid leaking or contaminations. Chemotherapy drug, IVI Alimta 600 mg in NMS 100 ml over 10 minutes D1. Indication, Alimta in combination with cisplatin is indicated for the treatment of chemotherapy-naive patient with unresectable malignant pleural mesothelioma. Second is Alimta in combination with cisplatin is indicated for the first-line treatment of patient with metastatic non-small lung cancer, then predominantly squamous cell histology.
The mechanism action for Alimta is a multi-targeted anti-cancer anti-folate agent that exerts its action by disrupting crucial folate-depending metabolic processes essential for cell replication. The side effect is nausea, vomiting, diarrhea, and constipation.
Medication is IVI Alimta 600 mg in NS 100 ml over 10 minutes D1. BSA calculation. Weight 35 kg, height 152 cm. So 152 cm multiplied with 35 kg divided with 3,600. So 5,320 divided with 3,600 equal to 1.4778. Our BSA is 1.215 m. So standard dose of Alimta is 500 mg per m.
Next is labeling for pimetrexate Alimta 500 mg per 100 ml. The label should have a cytotoxic drug handle with care and have a notes IV infusion in 100 ml, normal saline over 10 minutes. Storage is protect from light and store at room temperature. Safe transport. Transport using yellow cytotoxic box, clearly labeled cytotoxic, handle with care. And next is handled only by training staff with PPE, avoid spill or breakage.
Chemotherapy drug, IVINS 100 ml over 50 minutes D1. Indication, fluid and electrolyte replacement in dehydration, hypovolemia or shock. Used to maintain acid-base balance and hydration during chemotherapy. Mechanism of action, sodium chloride is an isotonic crystalloid solution. It works by restoring extracellular fluid volume and electrolyte balance. It mimics plasma osmolality, making it suitable for rehydration and as a carry for IV medication, side effect, rash, and itching. The medication is IVI normal saline 100 ml over 50 minutes D1. Dosing, volume prescribed 100 ml to give over 50 minutes. So 100 ml divided with 50 minutes equal to 6.66 or 6.67 ml per minute.
Next is labeling for normal saline 0.9% IV infusion for 100 ml. The quantity is 1 bag, to be given as IV diluent for Alimta chemotherapy over 50 minutes. Caution for single use only, discard unused portion. Storage is store below 25 Celsius and do not freeze. This medicine is for intravenous use only. Safe transport, placed together with Alimta in cytotoxic box, ensure label visible and dispose in yellow bin after use.
Step 1. Reconstitution. Take 1 vial of 500 mg Alimta. Add the recommended sterilized 0.9% NaCl, usually 10 ml to get 50 mg concentration. 3. Gently swirl to dissolve completely. Do not shake. Step 2 of dilute for IV infusion. 1. Take the reconstituted 500 mg solution. Transfer it into 100 ml of 0.9% NS for IV infusion. Mix gently to ensure uniform distribution. 3. Administration. Connect IV line. Infuse slowly over 15 minutes. Ensure pre-hydration with 250 ml NS has been given. Optionally, post-hydration can be done depending on protocol.